appreciate that. I mean, those are three different tools. They all capture somewhat similar constructs. Personally, I've just routinely used the PCS as part of my sort of basic regular intake package. But there's no reason why you couldn't use one of the other two. That's the habit I've gotten into. Each of them are telling me something about where I'm going to start into my treatment. All right, let's do another poll everywhere here. Curious on this one. Non-mental health professionals should screen for psychopathology in their patients with chronic pain. Not a single disagreement. All right, I'll go with that. Let's start with the why. Let's start there. Why do people think that us non-mental health professionals should be doing psychopathology? Is that?
That could be the cause of it.
Because that could be the cause of the pain?
It could be a psychological issue that's causing it.
Okay, so the comment was it could be a psychological issue that's maybe causing some of their complaints. Okay.
I think what you just said earlier, that it'll help you determine your treatment method, like what you at least start with, potentially.
So it may help us, okay, start with a treatment plan or where to start, yeah.
They might not otherwise be screened at all.
They may not otherwise be screened, sure.
I think it's also helpful to know if you have to work in conjunction with someone like a psychiatrist or something that addresses things.
So helpful to know if maybe you need to bring in a different professional, so maybe some multimodal or interdisciplinary care, something like that. Okay? All sounds reasonable. Someone make the argument for me, I think there's actually a fairly strong argument, that we shouldn't be. Anyone offer that perspective?
I guess the screening perspective I'm fine with, but I guess diagnosis would obviously have to be referred to someone else. And I think there'd be maybe the added thing of the fear of the stigma that comes with potentially thinking they have mental health issues.
Wow. All right. So I think probably an important piece here. First of all, Eric's just drawn the distinction between screening and diagnosis, which is probably important for this discussion. If I was to ask the question, should non-mental health professionals be diagnosing psychopathology? I'm guessing this answer would be no. Right. In much the same way as someone who comes in with neck pain, I may try and screen for vertebral artery insufficiency, or maybe a Pancoast tumor, which is a tumor in the apical lobe of the lung. I wouldn't diagnose those things, but I certainly would like to know if they were there because it's going to affect my treatment decisions. Okay? I ask about cancer and unexplained weight loss and night sweats because I think I'm sort of screening for cancer that may affect my treatment decisions. So is this different, do you think? If I use a depression screening scale? I have to admit, I'm somewhat surprised actually that there's widespread agreement because I think this is usually a bit of a hot topic when we discuss it. And I think there's a real scope of practice thing to think about here. I do think that Eric's probably hit the nail on the head with this, and that is that we maybe need not be afraid of screening for these things, for the potential that, say, depression exists. Clearly, we're not diagnosing it. Clearly, we're not going to treat it. But because it will likely have an impact on our treatment decisions, I think you can make an argument, at least, that we should judiciously, appropriately, prudently screen for these things in the right patients at the right time. Not as a carte blanche routine thing necessarily, but I think I'm okay with the idea that if you know how to use the tools, if you're familiar with them, if you know how to interpret them, score them, and this is sometimes where physios and OTs and whatnot fall down on the job here, have a plan for dealing with it if you get a positive result. Don't just leave them hanging. Then I'm okay with it. I will say I can't speak for the OT colleges. I have asked the physio college, at least here in Ontario, what their stance is on this, and they say they can't go to town. It's just like with anything else. I mean, we can do spinal manipulation, but you better prove, if something goes wrong, you better prove that you've been trained properly to do it, otherwise you're in trouble. Probably the same deal here. If something goes wrong, and things can go wrong. You go ahead and you decide you're going to screen for PTSD and cause some kind of psychotic break episode or something, and you better be ready to deal with that. So, like I said, I'm surprised there's as widespread agreement here as there is, and I think it's not nearly actually as cut and dry an issue as that.